Sharp, achy pain in your shoulder? Do this. My name is Dr. Nick from Preferred Physical Therapy, where we're committed to helping people 40 plus stay active and independent, live free from painkillers, and avoid surgery. If you've woken up and you're having pain in your shoulder, often folks will describe, it's not my shoulder, it feels like it's down my arm, even like it's in your arm bone. That commonly is a sign of a rotator cuff strain. The rotator cuff is a series of 4 muscles that attach to your arm bone. Think of the shoulder as a golf ball on a golf tee. This is the ball that rests on the tee, and the rotator cuff is a series of 4 muscles that strategically attach the ball of the shoulder to the golf tee of the shoulder joint. So what happens is we have this collarbone and this acromion, which is part of the shoulder blade, that form this bony hood over top of the ball. And there's this little bit of space underneath here. Every time we raise our arm up, we can get this banging and pinching underneath this acromial hood, and that causes this strain of muscle. The muscle belly sits right in here on top of that shoulder blade, that then causes this pain down the arm. So the first move I want you to do as you get up is I want you to easily roll your shoulders with your head high and tall. What tends to happen is folks want to roll their shoulders and they want to let their neck droop and fall. When our neck droops and fall, we close down our thoracic spine and we roll our shoulders forward. Doing this actually closes down the space in that subacromial hood. What we want to do is we want to open up. So bring the shoulder blades down and back. So we want to pinch them down and back, almost like we're putting our shoulder blades in our back pockets. Pull them down and back, and we want to elongate our head and neck. So we're going to roll our shoulders, thinking big and tall. We're going to do this 30 times. Go counterclockwise, and then do clockwise. So backwards and forward. If you do that 30 times, you're going to begin to lighten up the tension and strain across our upper neck and shoulders, as well as open up our postural stabilizers, which are responsible for the proper alignment or arrangement of where that rotator cuff muscle comes out and then goes down the arm. This next exercise, what you're going to do is get to a table or a countertop where you can rest your good arm. My painful arm is going to dangle down here in front, and I'm going to move my feet and my hips to get my arm moving. Now notice, this is different than if I'm stable with my feet fixed and I'm stirring a pot. We're not stirring a pot, okay? I want you to think we're a loose cotton rope. Our arm is just dangling down, and I'm moving my feet and my hips to get my arm to move and sway. It's loose and limp, easy movement. Think circles. You can also think back and forth. You're gonna do 30 seconds in all 4 directions, back and forth, in circles, counterclockwise and clockwise, just to get easy movement into that shoulder. It's imperative that you get moving. Find some movement that's not painful so that you can preserve the rotator cuff health. What happens, people will leave their shoulder and think, oh, all this movement hurts, and so I don't want to do anything. And what ends up happening is they develop frozen shoulder or adhesive capsulitis because they don't manage early on their rotator cuff strain. So it's vital that you do a few simple, easy movements and exercises to get that shoulder to move. Doing so is going to prevent further progression of adhesive capsulitis. Many folks will be confused as to how this even happened. How did I even strain my rotator cuff if I didn't really do anything? What tends to happen, these are called spontaneous rotator cuff tears. A tear is any kind of separation of the contractile tissue, meaning tendon or muscle. So anytime we have separation or tearing of those tissues, we get a strain or a tear. So not to be totally alarmed, this is not a complete tearing apart of now 2 pieces, 2 different tissues. This is any kind of separation or degree of tear to those structures. This can happen spontaneously, meaning just about your daily activities, whether you're reaching, mopping, or at a desk doing things. Little bits of wear and tear over time can begin to develop a degree of tear that now triggers an inflammatory event. And that can be problematic because a lot of patients will come in and think, I didn't do anything, nothing happened, I just woke up with this pain. That's very, very common. The other thing that can happen is we get folks who are like, I didn't really do anything, I just painted my roof the whole weekend, or I just did something that they don't normally do repeatedly for a time that involved a lot of overhead reaching. This time of year, we see it often with decorating the Christmas tree, putting up Christmas lights, any time of repeated overhead reaching when they're not used to doing that, particularly if we have these poor postures of forward rolled shoulders and a forward head. We reach overhead and we get more and more pinching in that subacromial space because of that acromial bony hood that I demonstrated with the model. If this persists for more than 2 weeks, take our quiz to find out how severe your shoulder pain is and know what to do next to get you back on track to living a pain-free life.